Tonight.
I've always struggled with my weight my whole life.
All the other kids were skinny, and I was one of the few that wasn't.
I started gaining weight probably the year I graduated from college.
An ABC 27 special presentation.
We knew we were both heavy.
You look at it as, all right, I'm destined to be heavy for the rest of my life.
When my son died, I started using food for comfort a lot. And before I knew it, I weighed 215.
Penn State Hershey Surgical Weight Loss presents The Wait is Over, Exploring Surgical Weight Loss. Brought to you by Penn State Milton S. Hershey Medical Center.
Good evening, I'm Chuck Rhodes. Obesity in the United States has become a serious problem. According to the CDC, the number of overweight children has doubled since 1980 and tripled among adolescents. Now about 60 million adults in the United States are obese. Tonight, we begin with Deborah Pinkerton in the ABC 27 call center with one patient story. Deborah?
Thanks, Chuck. A Lackawanna County couple tried diet after diet, a temporary fix for a short time. But Bob and Lisa Wormuth wanted a change that would last a lifetime. Lisa and Bob Wormuth take advantage of warm, sunny days. Ideal for walking, ideal for staying in shape.
2 years ago, I wouldn't even been able to walk across here.
Bob and Lisa laugh about that now, but it wasn't funny 2 years ago.
We knew we were both heavy. I was 330 pounds. That was the highest I was in my whole time.
I was about 240 when we had our second son.
Bob and Lisa struggled with weight since childhood.
I have a picture of me when I was maybe 3 years old, standing on a wash tub in my grandmother's yard in this little orange-pink bikini. And the bikini was so tiny, and I was just so far out of it.
I was about, say, like 10 years old. I wanted to go play football. I went to go, and when my dad brought me, weighed in, I was like 110 pounds, and the weight was like 105.
The pounds added up as Bob and Lisa grew up.
When I was a freshman in high school, and I just remember this from, it was like 210 pounds.
You go to college, they say you put on the freshman 15, it's more like the freshman 50, because you're not eating right, you're either eating, pizza or Chinese food trying to get to class.
Weight was an issue when Bob and Lisa met and married.
We have our wedding picture, and it's a nasty picture. We were both just overweight, bulging, the tuxedo I was in was like tight, you're just bulging.
A couple years after we got married, we had our first son. I was about 225 when I had him.
Together, they tried diet after diet, but nothing worked.
You look at it as, all right, I'm destined to be heavy for the rest of my life. You don't realize that, no, that's not the way it has to be.
Destined to be heavy with health problems developing.
I had back problems. My back had gone out, and then I was having problems, so I was on a medication for my back, for muscle aches. I had acid reflux, so I was on a medication for that. I had high cholesterol, I was on a medication for that. I also developed sleep apnea.
I was on high blood pressure, I was on a diuretic, I was on a joint medication and an antidepressant.
I hit 40, and when my dad was alive, what he would say is there's like somebody flipped the switch, and everything kind of snowballed. One of my heroes from golfing is John Daly, and I saw that he had gotten a surgery done, and he was starting to lose weight.
The more he talked about it, the more then I started to think about it. And said, you know what, I think he's onto something here. And then I started to research it.
Their family doctor recommended Penn State Hershey's surgical weight loss program.
Well, when they first came in, you could tell that they knew what their problems were. They didn't exercise, their portions were very, very large, and they just were not eating the way they should eat, and they knew that.
Typical Friday night meal. 2 extra large round pies with about 4 toppings apiece on, 2 orders of wings, and 3 hoagies. Okay, there's 4 of us in the house, 1 is a toddler. Guess what? There were no leftovers come morning.
In order to break those habits, Bob and Lisa needed to undergo a 6-month program before surgery.
We consider the 6 months as a supervised weight management. So what we do in those first 6 months is we would anticipate that they would lose weight, they would start to exercise, they will journal their food intake.
Bob and Lisa did all of the above, but more importantly, they gained their son's approval.
Just watching our teenage son, he was so proud of us that this is what we were going to do. Because he always used to tell me, why can't you look like the other moms? Because so many moms would be skinny, I would be one of the heavier moms. He didn't realize it at the time, that how much that bothered me. Sorry. But he was super excited that I was going to look like one of the other moms.
Bob and Lisa were excited too. They chose to have gastric bypass surgery on the same day. Lisa went first.
It's called a Roux-en-Y gastric bypass, and what that is an operation where you make a small pouch, which is the upper part of the stomach separated from the larger lower part of the stomach, and then a loop of intestine is hooked up to the pouch. So food takes a different route. It bypasses the stomach and the first part of the intestine. So nothing's removed, but it's a rearrangement.
I was worried for my wife because she went in first. Dr. Rogers was very consoling and comforting to me. She came out and she said, you know, Lisa did fantastic. She went through the surgery great. And I said, okay, you know, I said, brilliant. I'm really nervous about this. I said, I hope this works. And I just, she said, you'll do fine. You'll be great at this. And it was a time, it was a change. And it was something new. It was the start of a new life for both of us. And it was a really good thing. One of those things you never forget.
A new beginning that began the day after surgery.
After the first week, you started to see the weight loss come off. In the first month, it was drastic. And then it just kept coming off and coming off.
It's a strenuous process, but you do it and you follow the book, follow the program, and that's what got us through.
I'm down a total of about 105 pounds altogether. I went from a size 22 to a 2.
I went from a size 48 in a 3X shirt to a large shirt and a size 36 pants. And it's fun to shop now. Too bad there isn't a pond around. I'd dump you in it.
Bob and Lisa smile and laugh, and now they really mean it.
We had each other, and that was great. That was the best part of the whole thing, was we did this together. We did this journey together.
And those are tears of joy. Bob and Lisa say the journey was wonderful because they fell in love all over again. Both are very active. Bob recently ran a half marathon. Chuck?
I tell you, Deborah, that's a remarkable story, and the fact that they did both those on the same day. And joining me now on the set is Dr. Ann Rogers, who did both those surgeries back to back. And the first thing I want to ask is that unheard of, to have husband and wife back to back like that?
It's not unheard of. I've done a couple couples who have insisted on having surgery on the same day, and I've done an occasional mother and daughter. In general, we discourage patients having the surgery on the same day so that one will be ready to care for the other afterwards. But they were really determined to do everything together.
Takes a lot of planning.
Sure does.
Yeah. Now, each of these couple, they had gastric bypass, but what are the other types of bariatric surgeries that are available?
Well, gastric bypass is the most common operation for weight in the world, and it's certainly most of what I do. We also offer an operation called vertical sleeve gastrectomy, which is similar to the bypass. There's the adjustable gastric band available, and another operation called the duodenal switch procedure.
Okay, now, how do you help a patient decide which is the best option?
We ask our patients to come in with an open mind. Some patients come in thinking, I just have to have X operation, and we ask them to listen to everything we have to teach them about the different operations. And then when they meet with the surgeon, we talk it over and look at their eating patterns, their lifestyle patterns, their medical problems, and we try to pick an operation that will be best for them.
What about risks and safety? Talk about that for these kind of surgeries.
There are a lot of misconceptions about risk with bariatric surgery, and people like to tell horror stories, but the truth is that bariatric surgery is now the most common elective operation in academic medical centers. It's also safer than gallbladder surgery. People don't know that.
What do you say to people that say, oh, there's a quick fix, let's go for that?
No way is it a quick fix. Anybody who has to go through 6 months of school to get an operation, they're very committed, and they take a lot of time.
As we can see when we talk to the two of them, how excited they are about that. So let's check in now with Deborah Pinkerton and the ABC 27 call center. Deborah, it looks like they're busy over there.
They are very busy. Everyone is on the phone now. The number to call is 717-346-3333. Here to answer our viewer questions is registered dietitian Jackie Van Arsdale. Thanks for joining us. Here is the first viewer question. I'm 44 years old, 6'1" and weigh 270 pounds. I've been a diabetic for 15 years and have high blood pressure and high cholesterol. I've tried diets over the years, but I've had no luck. I recently lost my job due to taking insulin. I can no longer pass a DOT physical. Would I qualify for weight loss surgery?
You may qualify. Viewers who want to find out if they qualify can go online on our website and enter their height and weight into what's called a BMI calculator. If your BMI is greater than 40, you would qualify. For you, your BMI is 35.6. And along with diabetes, you would qualify. Many of our patients who have diabetes see a great improvement after surgery and are able to come off of their insulin shortly afterwards.
Okay, thanks so much, Jackie. Appreciate that.